Hey, my name is Kirk Hamilton, your host of the Staying Healthy Today show. This is a show where we bring you key experts in the fields of nutrition, prevention, integrative, and lifestyle medicine. And sometimes I also talk on topics myself, of which I'm going to do tonight for the individual, society, and the world. And this is really an individual for the individual, and it's for society. And it's about, well, I got excited today because I was listening to the McCullough Report, as I do every week, a couple times. It comes on twice weekly by Dr. Peter McCullough. Highly recommend it for all things COVID. Internist, cardiologist, epidemiologist, and very fact based. And he had a fabulous interview today, and it was from a Brazilian researcher who had been treating what he calls post spike syndrome. Here we might call it long haul, and whether it came from uh, people who had had just the vaccine or whether they had had uh, COVID itself and no vaccine, or whether they had a combination. And he started noticing this syndrome of fatigue, energy loss, brain fog, neuropathies, um, reinvigorating of certain illnesses, reactivating of certain illnesses in around January of 2023. And he started noticing several cases per day of these type of this syndrome occurring and still occurring. So they thought about it, and they become aware of Bifidobacter being low in COVID patients, and so they decided somehow to treat the gut with antibiotics first to kind of kill off any altered bacteria from the COVID infection, or somehow it releases the virus, the spike protein, um, during this process, which is damaging the mucosa of the gut. Secondarily, so they did this with Cipro. So they did a four-step process. They did it with ciprofloxacin, a very old antibiotic that's used for many things, but at 500 milligrams a day for 5 days initially. One person, one case study wasn't able to take that because they'd already been on augmentin, and then they went on moxifloxacin for, I think, 14 days before that. So that was the only one who didn't do that part of the protocol. And then they followed up the protocol with nattokinase, which we know from Dr. McCullough's work to break down the spike protein, or it has an anti-clotting effect. So it may treat some kind of vasculitis, and that was 100 milligrams twice daily for 90 days. They treated also with ivermectin. Ivermectin has an antiviral and anti-inflammatory effect, and they did it at 6 milligrams per 30 kilograms, and that dosage 3 times a week for approximately at least 8 weeks. And then lastly, what they did was they replaced the, the intestinal flora after they'd done the antibiotic therapy with Bifidobacter, 335 milligram twice daily for 90 days. And again, we've known somehow Bifidobacter has been low in COVID patients and plays a role. Now, the way that the gut would play a role in these inflammatory conditions, and here are the 5 case studies of serious illnesses that actually improved after this treatment. Granulomatous dermatitis, so that's a skin condition, interstitial granulomatous dermatitis. Polymyalgia rheumatica is a rheumatologic disease where you have multiple joint pain and muscle pain, but and then you have peripheral polyneuropathy, which means neuropathies or numbness, tingling, or some kind of nerve dysfunction in peripheral. It could be the arms and the hands, or the feet and the hands. And then drug refractory epilepsy. So that was seizures that weren't controlled very well with drugs. And trigeminal neuralgia, which is an inflammation of the fifth cranial nerve, and can be very, 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 very painful. So each one of these individuals had this condition. They went through those protocols, and all of them dramatically improved. So the question is how? And the belief is, and the suspicion is, that somehow you're either treating COVID in the gut or you're treating the spike protein in the gut. And then you're re-inoculating the bowel, so the gut wall heals. And when the gut wall heals, there's a term called leaky gut or intestinal permeability. And when that seals up, then you have less inflammation and then you have less disease. And we've known that for many other conditions. So this is quite exciting, and because since January of 2023, he's treated 400 patients. His group has treated 400 patients in this manner, and so with remarkable results. So this is, to me, a treatment for long haul, but you can call it whatever you want. But I highly recommend you, number one, listen to this Substack, click on the article, read my summary, and then go to the podcast that Peter McCullough has done, and I have a link there, and listen to it several times. There's a little bit of language, I don't want to say barrier, but you have to listen because of the accent. But this is very profound, and this is something that anybody can do. So number one is don't get any more COVID and vaccinations, because there's a difference between the spike protein that is naturally created within an infection than the spike protein that's created by gene therapy. So the vaccine is messenger RNA, tells our body to make the spike protein, but it's an altered spike protein. And it also comes in lipid nanoparticles. So it may go everywhere. We don't know how long it lasts in the body. And it's probably, I think, a more difficult animal to treat. And lastly, I want to say that if you remember this dovetails with my last interview I did, where it was in print, of a Dr. Makoto Abui, who is a gastroenterologist and a pancreatic cancer specialist, who noticed that all of a sudden his patients, since the time of the vaccine, since 21 and 22 and 23, or 22 and 23, they had an increase in not doing well. I should say they had less survival times, and they were having lesser benefit by the cancer treatment that was good before. And what he did was he did a study that linked the number of COVID vaccinations, 3 or 4, reduce the time of survival in these patients. So there's something about the COVID vaccine, and I say it's a spike protein, and many people do, that's negative, and you just don't want to do that for a variety of reasons. Okay? So my name's Kirk Hamilton. There's the links below to these articles. Don't forget to listen to Dr. McCullough's Substack. It's excellent. Listen to it 2 or 3 times. I have the link there. I'll talk to you soon. You have a fabulous day.